Borderline. What is borderline personality disorder?
If I could use one word to describe borderline personality disorder, it would be the word unstable. These patients have unstable sense of self, unstable relationships, unstable moods. They're very impulsive. I think two other characteristics commonly seen in these patients is they will do almost anything to avoid feeling abandoned. I want to say that the abandonment doesn't have to be real. It can be imagined. And probably the hallmark of the disorder, or what people most frequently know about it, is they tend to be quite self-destructive and self-mutilation is relatively common.
What are the signs of borderline personality disorder?
Since these patients will make frantic efforts to avoid a sense of feeling abandoned, they will be very needy and dependent. Now, as I say that, while they're very needy and don't want to feel abandoned, it should be mentioned that dependency on others, while they feel it's absolutely necessary to their continued existence, they also find it rather terrifying and intimidating. So the clinical presentation of a patient with borderline personality disorder is very variable. It's incredibly variable between patients. It's incredibly variable within a single patient depending on what time of day you catch them and what kind of mood they're in. However, I would tell you that invariably most of them will report a chronic dysphoria and unhappiness. They often have feelings of emptiness. Their relationships with other people tend to be very stormy and ungratifying. They often will fluctuate between totally idealizing you and completely devaluing you. So at one moment, you're like the most wonderful guy they've ever met in their entire lives. And the next second, if you disappoint them or do something to upset them, they hate your guts and never want to see you again. Which can explain some of the interpersonal dysfunction in these people. As I mentioned before, perhaps one of the more dramatic hallmarks of the disorder for which a lot of people know them for is the self-mutilation. Now this is distinctively different than suicide attempts, although these patients will make suicide attempts. However, the self-mutilation is described in a whole different vein. What patients often describe as a rising tension that they're unable to tolerate. And one of the ways they get rid of that tension is if they cut on themselves. So you'll see what people often refer to as hesitation marks, but it's like superficial cuts, all of. And once they feel the pain or see the blood, they'll describe this, the release of that tension that they're unable to tolerate. I'm pointing to my arms here, but oftentimes patients will make those cuts on their legs where somewhere that can't be readily seen.
What are the causes of borderline personality disorder?
I think there's two schools of thought. There's definitely a group of people who feel that borderline personality disorder has some biological basis to it or genetic component. It is more common in people with first-degree relatives that have borderline. Again, I don't think that this is necessarily means a genetic component. Probably one of the best ways to become a borderline is to get raised by one. So, that higher family incidence may represent a learned behavior. There's also another school of thought that this is developmental. In other words, there's a lot of literature devoted to examining the developmental deficiencies in parenting that patients with borderline personality received or actually failed to receive. It is interesting to note that a large number of these patients have childhood histories of sexual abuse, physical abuse, and or neglect. The degree to which that is causative in terms of the personality disorder is unknown at this time.
What are the dangers of borderline personality disorder?
I think first and foremost, is that because these patients are prone to making suicide attempts or suicide gestures, is that, you could really kill yourself accidentally, even though that may not have actually been your intent. I've also seen them hurt themselves incredibly badly in a suicide attempt that they've misjudged. One gal, for example, jumped out of a second-story window and was paralyzed from the neck down for the rest of her life afterwards, and that clearly wasn't her intent. I think she had hoped that she'd be injured in a rather dramatic fashion, but she got a lot more than she bargained for. In a less serious manner, though, I think the other dangers involve chaotic, stormy, ungratifying interpersonal relationships with other people, mostly based on these patients, fluctuating moods and presentation, as well as their tendency to become incredibly angry. It's difficult for them to have relationships that are meaningful or that last to any degree. They are prone to depression and anxiety disorders as well. There are a lot of what we call comorbid diagnoses seen in patients with borderline personality disorder, and that means comorbid refers to other diagnoses for which they meet criteria for. So it's quite common for these patients to get diagnosed with a variety of mood disorders, anxiety disorders, as well as eating disorders. And substance abuse is also very common in these patients.
Who is at risk for borderline personality disorder?
It hasn't been exactly worked out in terms of actually being causative, but these patients have histories. It's very common for these patients to have histories of physical abuse, sexual abuse, and or neglect. It would appear that that may represent a risk factor. It is also more common in the first-degree relatives of patients with borderline personality disorder, which might represent a genetic component or perhaps even a learned response.
What are the treatments for borderline personality disorder?
There have been books and books and books written about the psychotherapy of borderline personality disorder and how you should do it, and lots of different ideas about how it can be accomplished. I think in general, though, it's trying to develop some insight in these patients that their behavior is actually responsible for people's reactions to them and the chaos in their lives. Treatment, the individual psychotherapy with a borderline patient can be very challenging because they will try to recreate the chaos in their external lives, the internal chaos they feel. They'll try to recreate that in the psychotherapy setting. So, if you have a borderline patient in psychotherapy, hold on, right? It's going to be kind of a ride. You've got to be able to tolerate the ups and downs. Oftentimes it will almost appear as if the patient is trying to go from crisis to crisis to prevent any meaningful work getting done in therapy. And a lot of what you end up doing is managing those crises. What we end up doing is treating a lot of the symptoms. Lots of mood stabilizers or anticonvulsants have been used to address the impulsivity seen in these patients, or even the rage attacks that they're prone to. Since many borderline patients meet criteria for mood and anxiety disorders, it's very common for them to get treated for that as well. And then they are prone to transient psychoses when they get stressed out, and so it's not uncommon to see them on low-dose antipsychotics.